Hello all. Greetings to everyone. I am Neha Antal, Assistant Professor, IMS Ghaziabad University College campus. Today we will discuss on athlete's foot. Athlete's foot is a fungal disease which caused by fungus. What is athlete's foot? First, we will study what is athlete foot. Athlete foot is basically known as Tinea pedis, Tinea pedum, Caucasian foot, and ringworm of the foot. Tinea is the name of a fungus, and pedis belongs to pedia, means foot. It is a fungal infection that affects the upper layer of the skin of the foot, especially when it is warm, moist, and irritated. Because fungus, the basic environment or suitable environment for a fungus to grow is warmness and moist area. These basic signs of athlete's foot like fungal infection. What causes athlete's foot? The fungus that causes athlete foot is known as trichophyton. This is the culture figure of trichophyton, and this is a microscopic view of the trichophyton fungus. The most common species is Trichophyton rubrum or T. mentagrophytes fungus, which is a basic common causal agent of athlete's foot. Your chances for getting athlete's foot increases if you wear closed shoes, especially plastic lined one, and you keep your feet wet for long periods. Develop if you have developed a minor skin or a nail injury, and the most common reason or basic one is if you sweat a lot, then you are most probably to be uh, the to be the person of athlete's foot. Causes and epidemiology. Split by simple touching an infected person's foot and then touching your own cause fungus is highly branch structure, basic, smallest one. Their spores are airy and light in weight. So if you touch an infected person, most probably there are the chances you are touched in with the fungal spores. And then if you have a wound or any infected open area in your body, fungal mostly enter through this and then transfer into the bloodstream and then cause you the disease. Easily spread and get it from coming in contact with the fungus. Moisture between toes causes it as the bacteria grows faster in the moist areas. Symptoms. We will discuss symptoms. What are the symptoms of the athlete's foot? Dry skin, scaly one, patch, flakes that appear on the skin. The skin on the foot begins to peel and crack. Dry skin. Scaling is there, inflammation, itching, hotness, burning sensation is there. Skin between your toes burn and itch. Small blisters on the skin which are filled with fluid. Toenails change color once. If your toenail gets infected with fungus, there is a 100% surety that your nail changes color into different one. Bad odor of the food, blisters lead to cracking of the skin. Yes, these is the symptoms. There are dry skin, inflammation. These are the vesicles or you can say pustule formation. These are the skin inflammation and scaling of the skin. Diagnosis. There are three different types of athlete's foot which the which can be diagnosed on the basis of their symptoms, how they appear on your body. The first is toe web infection. Toe web infection, it is present between the toes, normally with the skin that is scaly, peel and cracked. Next comes Caucasian type infection. The skin on the bottom of the heel becomes thick and cracks. Vesicular type, vesicles formation is occur. Vesicular type, there are fluid-filled blisters under skin, typically on the bottom of the foot. Like to say, this is a toe web infection, formation of a fungal infection, dry skin, scaly between the toes. These are vesicular types. pustule formation, fluid pustules formation, mucation type, hard, dried skin, cracked skin formation. Treatment and prevention. It can be treated with medication as well as home. Can be treated at home with lotion, cream, or spray. In acute cases, doctor may give you a prescription. Keep your feet dry and clean. Wear sandals or shoes in places where your feet can get wet. Do not share shoes with the people. Wear shoes that have a circulation. If you sweat heavily, change socks regularly. How to cure athlete's foot? There are certain things as it is a fungal disease. The most common one is anti. You should go for the antifungal one. Use antifungal creams or spray. Two types are used: topical one and hydrocortisone treatment. Topical one our basic one, we use clotrimazole, meconazole, tolnaftate, naphthine, and butanafine. Next comes hydrocortisone treatment. Hydrocortisone treatment reduces inflammation which occur in body, redness, hotness, itching, burning sensation. It eases with this but cannot be used for longer than 7 days. And if you go for an oral tablet, then oral tablet is fluconazole, itraconazole, crizofulvin, terbinafine. Oral drugs are comparatively toxic and expensive.